Do you see health advice on social media?
Yes.
I actually see a fair bit on like TikTok mostly.
Do you seek this stuff out or does it just pop up in your feeds?
No, I do seek it out, so yeah.
Things I will never do as a holistic health coach.
It will be on Pinterest or even like Instagram, TikTok. I feel like it's everywhere, like even if I'm not looking for it.
Especially as a teenage girl, I feel like a lot of it's like pushed towards me.
No, I agree. It's really hard to avoid.
New research from Melbourne's Royal Children's Hospital shows that 2/3 of teenagers are getting their health advice from social media.
Does this surprise you at all?
Yeah, I would not be going to social media for that.
It does surprise. I normally go to my mum for medical advice.
This isn't shocking to me at all. I feel like, because this is kind of the age where teenagers start worrying about their bodies and all that.
No, it doesn't surprise me. I mean, it can be good because you can get a lot of information very easily, very accessible, but if your favourite content creator is doing something, you can be influenced very easy, and especially kids, because you can't really blame them for just believing something they hear if it's an adult or, you know, someone in power.
But why are young people turning to social media when it comes to their health? What are the consequences of this? And is there a place for health information on our social media platforms?
I feel some people feel awkward asking their parents.
It's the same way how as people have been going into ChatGPT for searching up things. It's just the most readily accessible.
I mean, doctors they take time to go to see. It's expensive too.
As a public health researcher and practitioner, I really believe in, wellness, but I don't think that a lot of what is being discussed in terms of wellness on social media has any evidence to back it.
This is Dr. Brooke Nicol from the University of Sydney. Dr. Nicol has looked into misleading health information on Instagram and TikTok.
Kim Kardashian had famously posted on her Instagram about having a life-saving full-body MRI scan. And that really caught my interest because we know full-body MRIs are not recommended to healthy people because the harms outweigh the benefit. And I just thought, wow, how incredibly interesting that someone can reach a huge audience with the click of a button and potentially, mislead them or give them information that has no evidence of benefit.
I feel social media is really hard for that. You can't actually tell if what they're saying is true. There's so many trends. It's just they all start every single day and I'm like, okay, wait, should I be following this or following that? It's you don't know what's what. Personally, I get very paranoid and I feel I know a lot of other people that do too, and then they compare and they're like, oh, this is what I need to be doing, and it's so easy to get swept up in.
Dr. Nicol and her team analysed almost 1,000 social media posts about 5 popular yet controversial medical tests that are promoted on social media. They found that while 87% of the content mentioned the potential benefits of the tests, just 15% mentioned the potential harms. On top of this, only 6% of the content referenced scientific evidence, and around 70% of people creating this content had a financial interest in what they were promoting. Dr. Nicol also found these posts had an estimated reach of 200 million people.
I think the misinformation is pretty rife. It is really concerning when it's this medical and health advice being given, and most of the time the people lacked the credentials to do so. Doing a lot of these things that are on social media and being talked about, they're probably just really a waste of time and money, but that's probably the best case scenario for a lot of them, but at worst, they could potentially be harmful.
People just want to see a quick video explaining things, and it's probably not even backed up. There's probably no scientific thing proving it. People just want quick fixes, I guess, for their health issues, yeah.
Dr. Nicol isn't the only one looking into this topic. Over the last few years, particularly since the pandemic, there have been many studies looking into health advice and misinformation on social media. And topics include everything from vaccines to mental health to contraception.
So we know that a lot of young people are turning to social media to learn about their health. That's common knowledge. And that includes, of course, also health information on contraception and how to use it. And I've seen this as well with my own daughters and their friends.
Dr. Demul Mendel looked at 100 of the most popular TikToks about birth control.
Together they had nearly 5 billion views and 14.6 million likes. We noticed that only 10% of the videos were created by medical professionals. and that most of them were created by general uploaders. So those are just people talking online, but also influencers.
Dr. Demal Mandel says the algorithm is part of the problem, as it pushes content that gets lots of engagement, but isn't necessarily accurate or reliable.
What was the most worrying actually is that most of those content creators explicitly rejected hormonal birth control, such as the pill or hormonal intrauterine devices or implants. Even though those methods can work and can be effective, most creators don't really talk about the limitations, and there are a lot of limitations. It could lead to making unsafe contraception choices, which then ultimately can lead to unplanned pregnancies, as well as an increase in sexual transmitted diseases. Unfortunately, we already see that happening in Australia in the past few years. And on top of that another impact is, of course, that it can lead to a further decline in the trust in healthcare professionals.
Dr. Demal Mandel also found 1 in 3 content creators express they don't trust medical professionals. And this could be playing a role in why young people are turning to social media, particularly when it comes to reproductive health.
Sometimes people feel that doctors don't really listen to their individual concerns.
In my experience, seeing like comments online and stuff, it seems like people are kind of losing trust for, doctors or whatever normal health things and just believing what they see online.
Both Dr. Nicol and Dr. Demal Mandel say there are benefits to having health information on social media, such as building communities, sharing stories, breaking down stigmas and raising awareness. But they are also calling for more regulation and encouraging us to try and be critical of what we're seeing.
A really good thing to keep in mind is if it sounds too good to be true in terms of your health and medical information online, that it probably is.
I'd be mindful when following like trends, because a lot of the things like they can look cool because cool people are doing them and stuff like that, but a lot of the long-term risks with certain things, like you don't really know about them.
I think it's definitely important to talk to a trusted adult and seek out advice from people you know in person, or even if you have health questions, you could easily go to a doctor or something and they would definitely have better advice than some influencer online.